We have the doctors on hand. We have Dana ready to go to, and we're going to talk about. I'm thinking you're doing is it called microneedling? What's this procedure called, Doc?
Oh, this is microneedling. So it's a new concept. There's lots of different ways to sort of exfoliate the skin. A lot of chemical pills, facials are about taking the outer surfaces of the skin off in order to make the products work better. Well, this is a little bit different because it's microneedling, so it's doing something more than just taking the outer surface. It's actually going to be trying to poke little tiny holes all over the face, and by doing that, you're inducing the collagen. In other words, you injure into the skin deeper so that you can turn on those fibroblasts and create collagen. And then, of course, with that, we've surely been looking at some other possibilities of adding products to. You can imagine if there's sort of a mesh of little holes all over the face, if you put products on them, they're going to penetrate better, especially right after. And I think Nana's been looking into the possibility of doing PRP or something like that.
Right, and you know, this is as you can see, it's a very tolerable procedure. My wife just had this procedure done, I think it was last Friday, and we were able to go out to eat. She was a little worried because she was a little red, but by the next day, you know, she was still a little pink, but it was, people really wouldn't know that she had anything done. And it's a wonderful way. It is a treatment that is done in stages, or I'm sorry, you have to have it done several times. Okay, and it's as you can see, it's a very tolerable procedure.
So the end result, Doc, would be, you know, you say you expect high results. You like the bar being high.
Yeah.
What
you should be able to tell the difference after you do a series of treatments. You should definitely see your skin is different. Hopefully, you're going to see a better texture, better pore size. You're going to start to have fine lines improved, especially around the eyes. So it depends what product we use with it, and whether you use growth factors and have them absorb in the skin, moisturizers. You can kind of see on the forehead maybe the sort of pink or the red. You can sometimes, this is aggressive, you can sometimes even see little punctate bleeding, just little tiny dots of blood with this that will heal very quickly in just a couple hours. So you can put some makeup on later on in the day and go out. But it's really causing some very micro injury to the skin. And with injury always comes healing, collagen and healing. And you do it in a controlled fashion. Nobody wants to have a big open wound. So it's sort of like laser light. So it's like a little laser procedure, but just in a very small version of it.
Interesting. You can definitely tell the difference in the pigment of her skin where she's working. Dana, you're our play-by-play person there. You're on the scene.
Tell us what you're doing.
Please.
Okay, well, just like he said, you are basically kind of puncturing little holes into that skin, stimulating. You're doing a controlled injury, basically, which stimulates your skin to promote new collagen, more elastin, new cell growth, and heal that. Great for texture, fine lines, wrinkles, increasing the collagen in the skin. Basically, all skin types can do this. Great for acne scars. Little downtime. You have redness, maybe a couple of days. This redness that she has on her forehead does go down pretty quickly, and you can get a little puffiness. And your skin may have a little bit of peeling or flaking for a couple of days, but generally a minimal downtime.
And it's really nice, somebody that's sensitive to chemicals and like with chemical peels where you really want to get a little more aggressive, they're going to be very sensitive. You can do this very easily because it's just little tiny holes, so it's very well tolerated. And then, of course, if they are having some irritation, you can put products that will absorb through the skin and sort of calm down the irritation too. So it's very, very nice.
Who is a typical client that could benefit from this procedure?
Everybody.
Everybody.
Yeah.
There we go. There we go.
Everybody can. But, you know, clearly it's not going to create, if somebody is 70 years old and has significant wrinkling, it's probably not going to make enough changes to really be discernible. So the earlier you start with these type of procedures, the better. But, you know, somebody in their 30s, 40s, into their early 50s as a first-time treatment. But really everybody benefits. It's, you know, what kind of results you're going to see.
I wish we had your client, Mike. Thumbs up if it does not hurt. How is that?
It doesn't hurt.
Does not hurt.
Yeah.
Okay. Okay. I think she probably was.
She's very tolerant though, and she has great desire. So you know, part of it's that she'll
Highly
motivated.
Highly
exactly.
motivated. There's nothing wrong with that. Okay.
Yeah. So I think it's a perfect example of, you know, really us trying to bring you know, to our clients the newest technology. This is very popular. If you're looking in Vogue or looking at New Beauty or any of those media outlets, you're going to read a lot about this. It's a newer concept. And as long as we think it's efficacious and patients, it's well tolerated, we do it. If something hurts too much, we don't bring it into the practice because I'm telling you what, it doesn't sell itself. You know, nobody wants to I do not want to be known as the house of pain. You know, so you know, beauty doesn't have to be painful, but sometimes it is a little bit. But we try to make everything as tolerable as possible. But this looks very comfortable. This looks very similar to like microdermabrasion, which is a, you know, I think it's similar. And it depends on how sensitive you are. there are people that have very sensitive skin and maybe a little bit more difficult to tolerate.
You know, since it's the NCAA season, we're going to keep doing these basketball analogies. So you have a first-team All-American there in Dana who does it. Dana, how long have you been doing this procedure?
This procedure here is, we've been doing it for a few months now.
Right.
Kind of introduced it. It's very similar, actually, to my permanent makeup as far as using the same type of hand device. So very familiar for me.
Well, it does look like her face is turning somewhat of a U of L red color. I'm not sure if you can see that or not. So, you know, no partiality here, but I do happen to see that.
Go Cards. All right. Dana, thank you very much. And your client
Thank you, Natalie. Thank you, Natalie.
Natalie, thank you very much. Beautiful client. And yes, we are talking about the big game. You want to look younger at the game? They say, wow, look at you. You look like you could be out on the ball court and be a cheerleader. That's how good you look.
Fantastic.
It all happens. It all happens at CaloSpa, courtesy of Dr. Mitsuguchi, courtesy of Bradley Calabrese, Dr. Calabrese, and of course Dana over there, the esthetician. Thank you very much. All right, we are coming to you live.